I'm part of the team working on the Vivaldi Ascot and ethnography project that Lavinia just talked about. And my name is Nicola Schmidt Renfree. And I'm a research fellow in the Centre for Dementia Studies in the Brighton and Sussex Medical School. And I'm going to talk about communication in and with care homes during COVID outbreaks and the importance of communication. And it's one of the things that we're looking at in the Vivaldi Ascot and ethnography study that Lavinia has just talked about. As we know, communication serves a number of functions, and it can be both verbal and non-verbal. And a lot of it is not really thought about. It's just, it happens and we get an impression of it. And there is a difficulty with asking people what they remember of what was said, because they will very often just have an impression of what was said, but not remember the exact words. So catching data on communication is not always simple, and this is one of an important reasons we have the ethnography study in the Vivaldi Ascot project. I have listed the functions. These are sort of general umbrella terms, and the functions of communication include things like practical elements like giving and receiving information, getting things done, asking people for advice and know-how and expertise. We also use communication for pleasure, for entertainment, for enjoyment. And I've included storytelling there, anecdotes, humor, joking. Teasing may not be for everyone's enjoyment, but it might be that the teaser enjoys it, but the teasee doesn't enjoy it at all, but I've included it there under entertainment, pleasure and enjoyment. Communication is of course also used for therapeutic reasons, for expressing concerns and anxieties, for getting things off your chest, for gaining reassurances, for finding out whether other people are in similar situations as you are, whether people share thoughts and opinions on something, whether their experiences are different. And that's also an important part of our communication. We also have self-development learning, CPD, as an element of communication where we learn from books and lectures and talks and teachers. And we also have a very important part of communication, which is about relationships and bonding. And we maintain and develop interpersonal relationships through talking with people, through being present with them and spending time with them. We engage in social bonding with other people, and it may just simply be, that quick comment that someone utters in passing, even when you're at the bus stop and someone says to you, "Lovely day, isn't it today?" as happens quite often. And you reply, "Yes, but it's going to be even nicer tomorrow." Or, "Haven't we had a lot of rain recently?" It's a kind of social bonding, and these exchanges are important for our well-being, as long as we look good in them. They help us to feel that we belong to part of the group, we're being included. And what's really important in social communication is also engaging in face work, enhancing your own face and other people's face. And there's a whole theory of face work in linguistics, which came from the work of Irving Goffman and was developed by Penelope Brown and Stephen Levinson, on how we do that in a verbal way as well, by enhancing the other's face, by making them look good and not feel bad. And that would include such things as thanking people or apologizing, etc. Showing sympathy and empathy, which we've had that lovely talk about empathy earlier from Yvonne and Steph. And this is a very important thing in social communication and social connectedness, that we can empathize with other people and at very least show sympathy, that we are listening to them, we are attentive, we understand them, and we feel for them. And being person-centered and developing, maintaining a sense of agency and well-being. Okay, these all come through good communication, whether it's verbal or non-verbal. So what happened in COVID and lockdowns is that the functional and practical, everything was kind of changed. And for this talk, I'd like to briefly mention the functional and practical in respect of getting information from governments to care homes and from care homes to the residents in care homes. And it turns out that there were quite a few issues with the information from governments, that they were not specifically written for care homes. In fact, they marginalized care homes. They were written more for the health service and for individuals. And some of the care homes, in a study that Lavinia and Jackie Castle did previously, showed that for some of the care homes, they were at the end of their tether, having to read 70-page plus documents to try and find out what they had to do in the care home, looking at a number of different sites and getting conflicting and different information. And there were frequent changes. So that study also looked at how care home staff were actually quite resourceful and proactive in developing best practice for their residents. But of course, that's an extra load of work that they had to do, in addition to looking after perhaps some very sick people and trying to isolate everyone and trying to work with preventative measures at the same time. So I just wanted to raise that. That's one side of the communication. I think Doreena's study also looks at that side. Entertainment, pleasure and enjoyment. Obviously, there was a lot less of this with other people. So residents suffered. There was also less time with staff because staff were so busy. Therapeutic reasons, we have a little bit of data, and this showed that, residents did become anxious during lockdowns, during COVID. They didn't know what was going on. One lady said that she's going to be 100 this year. And she said, yeah, it was okay going to the communal area. It was nice when she could do that, but she hated the corridors. And she always sort of breathed a sigh of relief when she got back to her room because she felt safe there. So there's a lot of anxiety going on. And of course, in situations of lockdown, when staff have less time to spend with you, when you're not able to see family members face to face or easily, who do you talk to about these anxieties? When do you talk about them? And for some of the residents, can they even articulate these anxieties, or do they become sort of embedded within them? And that's one of the things we're hoping to look at with the quality of life questions in the Vivaldi-Ascot study. And Naji, I just have to ask you, how many minutes do I have left? Because
How many seconds you mean? You have about 30 seconds.
30 seconds.
When you time it, it goes quickly, the 10 minutes.
Okay, I just can't see the timing because I've made my screen go into slideshow, so I don't have my clock. Okay, so relationships and bonding, of course, this was lessened, reduced during lockdown, and not just the talking to people, because there wasn't as much time to do that, and talking to staff, but also the physical, non-verbal side, the distancing through masks, distancing of space, lack of time by staff. Residents felt more isolated. during this time. However, when we asked about whether or not they could, they trusted what staff told them, in the case of one care home where staff has been there long term and the residents know them, they said they trusted the staff completely on the advice they gave them. And I think that, I mean, there's lots of detrimental things that came out of this lockdowns. One is loss of agency, another is loss of empowerment due to lack of being able to share decision making. And of course, there is the isolation and the anxieties that people are maybe don't have the ability or the possibility, the opportunity to articulate. I'm going to stop there because
Okay,
I don't know.
yeah, great. Thank you very much, Nicola. That was great.